Thank you, Congressman Deutsch. I'd now like to introduce Dr. Richard Weil, Chief Medical Officer of the Southeast Regional Office for Medicare and Medicaid Services.
Well, I'm from the government, like the Congressman, and I'm also here to help you. As just mentioned, I'm the Chief Medical Officer for the Southeast U.S. based in Atlanta for the Medicare program. We're about one-fifth of the population of the Medicare program here in the Southeast U.S. Now, let me ask you, how many of you have either yourself Medicare beneficiaries currently? Raise your hand. Or you have a loved one or family member who are on Medicare or soon to be on Medicare. So right, this is your insurance program. You own it. It's a mutual insurance program. And happy to have one of the 500 members of our board of directors on this. We're the one program that insurance company that no other insurance company wants to take market share from us. But that leads me to the point, is you know, our medical problems in this country are very large, and they're costing us, and they're affecting the economy. And Medicare is frankly fiscally alien unless we change the way we've been doing business. As Albert Einstein, who said insanity is doing the same thing over and over again and expecting a different result. So one of the things we found out in Medicare is that, my goodness, maybe it would cost less to keep people healthy than to keep taking care of chronic disease. And you know, occasionally there are some brilliant ideas that come out of Washington and Congress and the government, and that's one of them, because we have to change the way we've been doing business. And for so long, Medicare was like any other insurance company. We called ourselves a health insurance company. We weren't a health insurance company. We were a disease insurance company. We only paid for services once you got sick. Well, thanks to Congress and changing the law over the last several years, we've been able to start increasing our menu of preventive services benefits that we're able to pay for people to get them to stay healthy. And most recently, we've even added more benefits where we have an annual wellness physical now that everyone can go once a year to see their doctor and talk about staying well instead of talking about being sick. And getting a plan to stay well and get physically fit and eat well and reduce obesity. And this looks like a pretty fit group compared to some of the groups. I think all of those 30% obese people are within a few blocks of my office in Atlanta. But we are very much the stroke belt and the heart attack belt of the United States and Southeast U.S. Now, I have a personal story. I've got a few facts and figures, but one day, I used to be an ER doc. I spent 30 years as an emergency medicine specialist. And for the last 5 years as Chief Medical Officer for the Medicare region, my job is to keep you out of the ER. And that's even more exciting. And, you know, I know those 30 years are going hard on me. You probably know, looking at me, that I have not aged gracefully. And, you know, it's only been about 5 years or so that people stop mistaking me for George Clooney. If you believe that, I have a few more stories for you. But anyway, yeah, right, take away the fear. Just visualize. I try to do it all the time. But anyway, you know, I have a tale. I started doing this job as an ER doc. I started eating more, the stress bears on you. Too tired to exercise after 10, 12 hours in the ER. And then I started working behind the desk and flying. And one day I woke up. My solution to my weight gain is to keep buying larger clothes. And actually, about 6 months ago, I was sick and tired, feeling sick and tired. And I took the scales and I looked and I did my BMI, my body mass index, and it came out that I had just reached the obese stage. I was no longer just pleasantly overweight. And that's when I finally said I have to take action. So without, you know, there are many ways to do it, and with coaching and help of other people and diet and exercise, I got rid of it. To lose weight, it may come back. It may find it. But my diet and exercise and working out and changing my behaviors, and yes, I have a confession. I did get out and walk on the beach this morning while I was down here. It was for medical purposes only. And I think it can be done, and I'm living proof of that. My blood pressure is now normal. My cholesterol is normal. They weren't before. And I'm feeling great. The things I didn't do before. I'm a lot more confident in myself, and I can tell you, without any embarrassment, yeah, I know what it's like. So this is a real problem. Now, we're here today to help get the word out to all physicians and Medicare beneficiaries about our preventative benefits that we're offering. And as you know, we have recently started to cover obesity screening. Why? Because obesity is the root of most of our chronic diseases. And 1 out of every 2 people in the United States have a chronic disease, and 75% of all medical spending is on chronic disease. And it's bankrupting the Medicare system, it's bankrupting the country, it's bankrupting people's lives. And so this is a wonderful step in the right direction, where we can not only attack obesity, which is a symptom, but also a cause of heart disease, high blood pressure, high cholesterol, etc. This is an integral part of our Million Hearts campaign, where the government has a program now to reduce, to prevent 1 million heart attacks over the next 5 years. And 1 out of 6 healthcare dollars is spent on heart attacks and stroke, I should say. 1 out of 6 healthcare dollars is spent on heart attack and stroke, cardiovascular disease. That's actually $444 billion in our healthcare system. So, the list of our preventive services is too long to go into. It's a couple of pages now. You can get colonoscopy screenings, you can get blood pressure screenings, you can get depression screenings, alcohol abuse screenings, prostate, breast, etc. All with the primary focus to keep seniors healthy and avoid getting complicated. So we don't normally go to many openings of medical clinics, and we're not endorsing any particular provider or brand or anything else. But this is a wonderful opportunity for the government to get our message out, and we hope all physicians, all healthcare providers, especially primary care providers, and patients and Medicare beneficiaries and family members of Medicare beneficiaries. Because how many of you are caregivers? Yes, so we have preventative checklists now. You go on Medicare.gov, and you can even personalize it on MyMedicare.gov and get your preventative checklist personalized to your family. So we want to get this word out, this benefit's available. Thank you for the opportunity. Thank you.
Just to wrap up today, I want to leave you with one thought. According to the Centers for Disease Control, the evidence for the power of prevention is now indisputable. MDPrevent represents the first attack in this new armamentarium of things that have been made available to us through Medicare to get serious, to get real, to be determined. And I'll leave you with one final thought. Margaret Mead once said, "There is no doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." We are those citizens. We're starting a healthcare revolution today, right here, right now. Thank you for being here. Continue to enjoy the festivities. Thank you.